well, it's Facebook Friday. Dr. Gordon and Lynda coming to you here from Southeastern Fertility.
Hello.
Here we are. We're actually here in the embryology office, the nerve center here of the IVF program.
Or as Mark calls it, Fort Carroll.
Yeah, or as you say,
At Fort Summerfeld.
where one can find stuffed sperm, apparently. Okay. So, no, most sperm don't have two eyes. They don't. That's right.
And they don't laugh.
They don't laugh. They don't laugh. I think you guys did a great job last week with Kaylee. I loved it. I loved it. You know, just in time for her to go off, get married, and enjoy her honeymoon. So that was great. That's right. I was out of town. I was taking Susanna off for college visits, as they were. So we went up to Pittsburgh to Carnegie Mellon, and proud of her for getting accepted. It's a great school. I don't necessarily know if that's where she's going to go, but it's a hard place. It's a hard place, but smart kids. It's really smart kids. She's a smart kid. She deserves to be there, but she also has some other choices that appeal to her, as possibly pursuing the career of a Disney Imagineer. There may be some others, but we'll see.
That'd be cool.
Yeah, I would visit my daughter if she worked at Disney World. I go there. But in any case, this is her prom weekend. So yeah, do you remember your high school prom?
Yes.
Yeah, I remember mine too. It was bad. Bad. So I said, don't worry if it's not everything you hope. But we're doing our best, and I was out in the backyard, and I borrowed a power washer from a friend of ours. And have you used a power washer?
I started to, and when I went through the concrete and made a little hole, my husband took it away from me.
Yeah, you have to be careful not to power, but it is fun, and it's so clean when you do it.
Oh, it is.
You know, and you start power washing everything. You're like, wow, the deck looks good. Like, let's do the side of the house, and there's the dog. Let's do the dog. I mean, it's just, it's really hard to stop. You're like, let's do the furniture. Let's do, I mean. And you're right. You have to be careful. If you do like it's like
a really good hole if he'd let me go.
I know, because I was doing like the wood swing. I'm like, ooh, maybe I should have done the wood swing. So, but it is funny. You don't know when to stop, right? And we're going to talk about a little bit about limits in terms of stopping. So, since we're in the embryology office, I'd like to appoint you a new embryologist. So you're a new embryologist, okay?
Me.
You. And I'm gonna say, Lynda, I want you to help me fertilize an egg. And so I have this little needle here, and you're going to use this needle, okay? And the ones we use are actually, and you're going to take that, and I happen to have this egg here. I want you to go ahead and inject this sperm in the egg. Okay, go ahead and do that. Oh my God! Well, you maybe you just didn't do it quite right. So maybe that egg's not so good. So why don't let's try this egg. Maybe you can do it on this egg. I'm going to try that egg. What you want to do it? Actually, you can do it there. Yeah. No? No. Good. You can do it right there. Oh my gosh, that egg didn't go there. Oh, maybe it's the eggs that we're doing. Okay,
Scrambled eggs.
Let's scramble it. Let's try this one. Oh my goodness. All right, well, I don't know. Let's try this egg. This egg looks like you can do it right in there. Just right in there. Stick that sperm right in that egg, and it worked. It's amazing, right? Okay. ICSI is insane, right? I mean, this is like a crazy thing, right? I mean, even without our junior embryologist, Lynda, popping those eggs, when the Belgians introduced this in 1992, we all knew they were lying. Bunch of stinking, filthy, lying Belgians, okay? And, it's like, there's only two things I hate. People who are intolerant of other cultures, and the Dutch. Or in this case, the Belgians, right? That's Austin Powers. Okay. So, really, I mean, what a stupid idea. That you could take a needle, load a sperm into it, and stick it into an egg, and get a baby. Right? Because you knew this would happen, right? Look at the scrambled eggs on the floor here in the embryology. We made a mess. And I'm going to tell Carol it was your fault. And so, when they introduced it in the meeting in Boston, we all knew they were lying, because we knew, we've been trained that you can't do something as crazy as take a needle and stick a sperm into an egg with a needle, with the tail and everything, right? Mm-hmm. And they described their first children were born from the technique, and they named the technique ICSI, intracytoplasmic sperm injection, ICSI, and we figured they just lied, right? I mean, they must have done something that allowed them to have kids. Maybe they put in some IVF embryos with these other, but who could even get an embryo? Who could even not caused the egg to pop like that.
Right.
Then other clinics were able to reproduce it. And that's really the thing in medicine. When you can reproduce something, you know that it's real. And so suddenly other clinics were able to reproduce ICSI, and it seemed to work. And it worked actually fabulously well. And of course we're concerned, saying this is 92, 93, you know, are the children going to be normal? I mean, you're bypassing the selection criteria as to which sperm makes it to the egg. You know, kind of like at the prom, which boy gets the girl to ask her to dance. You know, you're eliminating all those selection criteria. Aren't the kids going to be mutants? You know, I mean, are we going to like all these, you know, weird, I mean, so it's sort of shocking now, you know, we're now, what says nice, so we're what, 8, 20, 30 years, right? You know, 28 plus, yeah, 29 years, you know? I mean, it's a long time, and yet it's amazingly effective that you can do it, okay?
And I was able to watch Sarah
Good.
and Carol
Yeah.
do ICSI.
And did this happen to the eggs?
No, it didn't.
No, it did not.
It was
you know,
amazing.
Because they're senior embryologists and you're the junior embryologist.
Right.
Plus, they had a microscope and you're just doing it freehand, so that's
Yes.
not fair.
Plus they locked me out of the lab anyway.
That's true. So,
So don't worry. I
So-
won't be doing ICSI on your
that's
eggs.
right. So ICSI really is amazing that you
It
can
really
you can
is.
do that, okay? And it is shocking. Now, just like power washing the dead, there's maybe a point where you don't necessarily have to do ICSI, right? And you kind of like, and there's this tendency like, well, if we do ICSI on male factor, then let's do ICSI on PCOS. And let's do ICSI on people who don't have enough eggs. And let's do ICSI just because it's Tuesday. So I'm just saying that there is a question as to, do you push it too far? And we've had this debate, you know, as to saying, well, who really benefits from ICSI? I say, well, clearly if it's a male factor, you gotta do ICSI. Clearly if it's sperm that comes from anywhere except the collection that the guy makes, you gotta do ICSI, okay? If you do testicular sperm, epididymal sperm, you gotta do ICSI, okay? If the sperm has previously been shown to not fertilize with IVF, do ICSI, right? I mean, that's kind of like a no-brainer, right? But what about unexplained infertility? You know, what about just because you're doing natural cycle IVF and have one egg only? That gets a little bit of a judgment. And the question is, you know, maybe this egg is happier not being ICSI. Okay, you didn't pop this egg, that's good, you know, but maybe that egg would have been happier without, how do you know? And that's the thing. So I think that it's a judgment in some of these situations. Sometimes what you could do is, if you had a lot of eggs, you could consider ICSI some versus ICSI all versus ICSI none. So again, I think that there is a question as to, you know, do you push it too far? And ICSI is a technique that really depends upon the staff doing it. And, you know, fortunately, you know, Sarah and Carol, excellent ICSI success rates. Lynda,
Not so much.
maybe not so much, you know. I had a patient today asked me, well, so Dr. Gordon, so you're the embryologist for my eggs. You know, you don't want Dr. Gordon to do that. It's okay, you don't want me doing it. You might end up with the scrambled eggs on the floor.
Now wait, we have a viewer question. Viewer question alert.
Alert.
Does ICSI help success rates when no male factor and analysis is really good, but female problem is endometriosis? Beth asks.
Yeah, that's a great question. And, you know, the studies would suggest that ICSI for non-male factor may not give you much of an advantage and possibly could be a little bit lower success. Okay, the problem is if you don't do ICSI and you don't FERT, you've learned something, but you've lost your cycle. So that's the issue, right? I mean, it's a very expensive diagnostic test to do IVF, not fertilize, and then you have to call a patient and say, well, you know how we weren't sure what the problem was? Well, now it looks like there could be a sperm-egg interaction problem. And they go, okay, now what are you going to do? I say, well, we do IVF again. It's like, what do you mean we have to do IVF again? So that is the issue, right? So, I mean, that's the problem. It's hard to really to show that. And we've kind of shifted in general, like some clinics have gone all ICSI, you know, never do IVF. I think here we've been judicious about our ICSI use, and you know, it's really hard to know. I mean, sometimes you wish you had that crystal ball, right? Because nobody wants to call a patient up and say you didn't fertilize, and yet, if we got a better outcome from not doing ICSI and we had known that, we would prefer not to do ICSI. And so that's an excellent question. It's one that we struggle with. And again, I think that I usually discuss with a patient and say, well, here's my view, and some patients have an immediate gut reaction to this, Lynda. saying, I don't want Lynda ICSIing my eggs. And I said, all right, well then let's not do ICSI this time, but if you don't fertilize, you definitely have to do it next time. So again, ICSI is a great technique. Maybe.
And this is not what happens.
Maybe not in our, this is not typical. Okay. And but I think there are those are really good questions, and it is amazing. It's really just amazing that this would even work. I mean, I remember being at the meeting in Boston and standing in the hallway because it wasn't that big a lecture room, and you were kind of looking in there going like, are they lying? Are they lying? Because we just knew this couldn't work. I mean, literally, it was the stupidest idea because this is what would happen. Look at this mess that we've made, and we're not cleaning it up, are we? I'm not. Mark? All right, so anyway, that's what I got for Facebook Friday. So,
very interesting.
Very interesting, okay. I'd like to see that in super slow-mo as the
yeah.
explode, okay. And
that's what it is.
that's right, exactly. Wish you all a wonderful week,
and we know Kaylee's out there watching because she has
know you're
nothing
watching.
better to do.
That's right. She had nothing better to do. Exactly right. Exactly. I mean, missing work for a wedding and a honeymoon.
I know.
Where are your priorities, girl?
Pigeon Forge is right up there. She goes the weekend, comes back on Monday.
That's right. And Dr. Key and I are captains of the ship. We're happy to do the ceremony for her.
Yeah.
Right here in the office.
Yeah.
Yeah, exactly. All right. We all have a wonderful weekend. Happy Friday, and we'll see you next week on Facebook Friday.